Good afternoon, everyone. My name is Margarita Birnbaum, and I am the Health Equity Beat Leader at the Association of Healthcare Journalists. This webcast is one in a series of training opportunities that are topic specific to brief health journalists on the latest information in a particular health area and to give you story ideas or resources that you can use in your work. Today's topic is reproductive health, and we are going to focus on women of color for two reasons. One is that Black and Indigenous women in particular have health measures that are poorer than those of non-Hispanic white women, but also other women of color. So we're going to talk about mostly topics related to Black women. Lauren is going to address that in her presentation and in the questions that I'll be asking her. But I'll be sharing a lot of resources with you that you'll be able to use in your reporting. And then Lupe will be talking a lot about the Latina Institute's work in communities in general, but in specifically Hispanic American communities, and you'll hear a lot about that. This webinar is going to go beyond maternal mortality. We're going to cover or touch on birth control use, abortion access, access to OBGYN care, C-section trends, which Lauren did a really good story about. And these are health outcomes related to reproductive health. And one of the reasons why we're not going to focus a lot on maternal mortality is because, frankly, I thought it would be a good idea to explore topics that would explain how we get to those trends. So again, we're going to start now, and my first question is for Lauren, and then we'll transition to Lupe. And you can read all about their bios online, so I'm not going to get into that. But they're going to be great sources for all of you who cover this very important topic. So Lauren, talk to us a little bit about how you got into the maternal health beat. And I know you also cover infant health, but for the purposes of this webinar, we'll talk more about your coverage of maternal health.
Sure. Hi. Thanks for having me. Oh goodness, am I frozen? Oh, there we go. Okay. I started covering infant and maternal health almost as soon as I started covering healthcare at all. It was 2013, and I had just gotten a job at the Post and Courier in Charleston, South Carolina, where I'd been hired to cover healthcare. And every year, I'm sure it's similar in other states, the South Carolina Health Department had put out its annual infant mortality report, which sort of gave the rate for the previous year and sort of laid out what the disparities were between Black infant death and white infant death. And as someone who hadn't covered healthcare before, there was just an enormous amount of information that I needed to learn. But it was helpful, I think, because this report came out year after year, and it just typically didn't get a lot of attention. But I was sort of looking at it with new eyes, as someone who had never paid attention to these numbers before, and I was just really shocked at the disparities that we were seeing in South Carolina. So that's sort of what got me interested in it. I started covering it as more than just like a daily story about a report. I found moms to talk to who had lost infants. And eventually, a couple years after I started the newspaper, I teamed up with an investigative reporter, and we wrote a pretty big project about how the infant mortality rates in some rural parts of the state were on par or sometimes worse than countries that are much poorer than ours. So anyway, that's kind of what got me started. It was just a press release, and from there it's sort of history. But yeah, it's always something that I've at least since I've been a health reporter for about 11 years now, something I've been interested in.
So how did you expand your coverage to go beyond maternal mortality, and what are some of the topics within maternal health that you wanted to expand on and that you still want to expand on and you think are not written about as often as they should?
Well, infant health and maternal health are so closely tied together, but they are technically separate. And I will say that I really started off with a focus on infant health outcomes. And it wasn't when I started writing about this, I would say that maternal health was not as much of a topic of people weren't writing about it. People weren't really talking about it. But beyond infant death rates and beyond maternal death rates, there are so many measures that are interesting to me. I mean, if you back up and look at it more broadly and say, why do these numbers matter? I mean, obviously it's incredibly tragic when someone dies, a preventable death, whether that's a baby or a mother. But really, these numbers are important because they give us an idea as a society. They're numbers that show how well we take care of one another and how well we care for the most vulnerable people. I mean, infants are literally the most vulnerable, right? They literally cannot take care of themselves. And these numbers reflect which states and which communities are doing a better job of caring for these people than others. So beyond the death rates, there are a lot of metrics that also sort of speak to that broader issue. You mentioned C-section rates. That's something that I'm interested in. State health departments keep a ton of data. I think it's really interesting to look at data on prenatal care. You can see how many appointments moms are getting, often drilled down, like because that's predictive of a healthy outcome. Like the more prenatal care you get, that's predictive of a healthy mom and healthy baby. So you can look at those measures. You can look at I believe you can look at, you obviously can look at race of the mother. You can look at the weeks of gestation. There's so many different ways to measure this. And a lot of times the numbers are just available online through your state health department. But yeah, so I hope that answers your question. I think I rambled.
You did, yes, and I see Lupe nodding a lot, and so I wanted you to, just jump in now, and if you could, what is going through your mind, Lupe, as you hear what Lauren is saying, and and the work that you do, what's going through your head as you hear her comments?
Yeah, I'm definitely nodding because I agree entirely with what Lauren is saying about how the rates of maternal mortality in this country, in particular regions of this country, the rates of infant mortality and adverse health outcomes for infants are entirely indicative of the systems of injustice that we have in our communities, in many communities in this country. And particularly if we look at who this is affecting, Black children, Indigenous children, and in many places, the rates of Latina folks who are affected by this are also rising. It's a result of systemic injustice that has existed for a long time in this country around access to care, very basic health care, around around systemic injustice related to conditions in certain communities, not having adequate resources in terms of like clean water, not having access to adequate food sources. So agree entirely that these rates, these conditions reflect back at social injustice that has existed for a long time in the community and is the center of really the way that we at Latina Institute, we call ourselves Latina Institute, but my organization is the National Latina Institute for Reproductive Justice, as you mentioned. And, it's part of the work that we that we elevate when we're talking about reproductive justice. It's intersectional work that really looks at all of the different systems of oppression, systems of injustice that people are subjected to in this country that keep us from being able to make choices about ourselves, our families, and our communities, and to really live in health and with dignity. And so, you know, so it's connected entirely. And our work, we look at combating injustice and fighting for reproductive justice in 3 ways. We work on federal policy, federal and state policy, to pass, you know, policies that really address systemic issues. We feel like, for example, Roe versus Wade and basic protections for abortion or basic protections for access to care don't necessarily reach those who are most marginalized, who have been, you know, mistreated by our systems for the longest time. For many people in our communities, even with the protections of Roe versus Wade, for example, you know, we didn't have access to reproductive health care. We didn't have access to abortion. And so we look at passing policy that really, again, addresses systemic injustice and systemic issues. And we do that at the federal and the state level. We also work on issues of organizing. We know that we cannot pass policy if the communities that we are serving and communities that again have always been ignored are not involved in the process of electing folks into office who are responsive to their needs, and also who see the necessity, again, to pass a policy that gets at the root of systemic injustice. So we do a lot of work to organize people, to build power, to train them, to build the kind of community consciousness and power that we know is needed to pass good policy and to hold elected officials accountable and to sustain that kind of policy change and investment in communities. And then the third way that we do our work is through culture shift and narrative shift. And so we talk to folks like you all about how to cover stories in the Latinx community. We talk a lot in the media when we're asked about abortion and about reproductive health care, about reproductive justice and what it means for our communities, about the intersectional issues. So, you know, we really want to be out in the world, sharing the stories of the people that we work with and we serve, and addressing mis and disinformation that exists about our communities and within our communities. So, so our culture shift strategy has various facets, but this is one of them. And I think elevating what was just said about you know, again, what these numbers mean and really telling the story about what these numbers mean is important. And we're a part of again, pushing for that story to be told about the injustice that exists and the root causes of these issues.
Lauren, in the story that you did about C-section trends, you mentioned that, and going back to that, this is it was one line, but for me, it was just really powerful as a reporter that I felt like, ooh, I want to pull more on that thread. That in the South and in Texas, women are more, they are in poor health or more likely to be in poor health than in other areas of the country going into pregnancy. And so that was striking and not necessarily surprising, but it was a great bit of context that you added. What was it that you looked at to give that context in your piece? What were some of the health measures in women that you looked at?
When you talk to physicians, it's mainly obesity and hypertension. Those are the 2 risk factors that are more prevalent among Black women, and that are more likely to cause complications in pregnancy, if I recall correctly. I think I read that article maybe a couple years ago now, almost. But it is really interesting, and you know, C-section rates. It's still you know, C-sections are a more complicated way to deliver a baby. And because of that, they're more likely to result in complications after birth, which obviously is not good for the health of the mom or the baby if they can be avoided. But interestingly, states in the South are also really sort of interested in these rates because they simply cost more. They cost the Medicaid program a lot more too. It costs Medicaid a lot more to pay for a C-section than for a vaginal delivery. And because Medicaid covers so many births, particularly in the South, yeah, those numbers are definitely, so there's an economic reason, and there are potential health reasons to pay attention to those numbers.
Your stories, connect the dots between slavery, discriminatory laws that came after that have affected access to care for centuries now, and current trends. So you connect all those pieces to give the reader this really good context. And besides your expert sources, what are some of the resources that you rely on to give that kind of depth to your articles?
That's a good question. I mean, data always sort of drives a lot of these stories, so I use a lot of data. I would not say like I'm a data journalist by any stretch of the imagination. Like I do not really know how to like manipulate an Excel spreadsheet by any means, but yeah, I rely on numbers a lot. And I've been following these numbers for a while now, so I feel like I can kind of see what to pay attention to year after year, and you start to notice trends. I also just read a lot. I think one of the best ways to be a journalist and to come up with new story ideas is just to be a reader. So I would say that you talked about history, and I do love history. In a recent story, I think you just posted in the chat, or maybe not. Maybe anyway. I wrote a story in December about Black women and health outcomes in pregnancy, and I go in a little bit about a history of this doctor who he is credited with inventing the speculum in the 1840s, and these experiments on enslaved women. But honestly, I first found out about him from just listening to a piece on NPR like a decade ago. So it's just I would just say I do rely on sources a lot. I do rely on data a lot. I also just read pretty widely in this area, and those three things sort of help me, provide the context that a lot of these stories need.
So when you say read widely, I mean, other than news stories, you're reading reports from think tanks, you're reading, studies that are coming out. Okay.
There's some interesting stuff. About a decade ago, there was a lot happening in terms of birth outcomes in South Carolina, and there's new research sort of showing how effective or not some of those programs are. So I would say I read research studies, I listen to the radio, I watch television news, I read mainstream articles. Yeah, I try to keep up with what other people are writing about, for sure. ProPublica obviously has done a lot of great work in this area too. So yeah, I would just I read a lot.
One of the questions that also came to mind in preparing for this webinar was that education and income are determinants of health, and these are determinants of health that we associate with better health, and that is not always true, and that is not true in particular for Black women. So how do you navigate that, incorporating equity and determinants of health into the trends? What are some of the things that you do to do that?
I am not quite sure I understand the question.
And I might not have asked it properly. I was just wondering about, it's easy to, there's stereotypes out there, many, about women of color, and one of them is that, the maternal mortality rate is only high among poor women who are also women of color, and that's not true in in maternal mortality. The Commonwealth Fund, as a lot of us who write about this know, and among other reports, came out a few years ago with one that showed that college educated Black women had a higher maternal mortality rate than Hispanic women and non-Hispanic white women who had no high school education. And so how do you, is that something you try to keep in mind, when you're doing your reporting and looking at trends, and writing about disparities?
Yes, I would answer that by saying that, like, at the end of the reporting process, I think I try at least subconsciously to take a step back and make sure that the people that I've interviewed and who I'm going to be quoting in the article are representative of what's happening. And if there are gaps, then it sort of means that I haven't finished doing the reporting.
Lupe, could you talk to us about some of what are some of the stories that you would like to see, about reproductive health in Latina communities, or that are not, maybe they're not being written about or not enough? So that's one of the questions I've got for you.
Yeah, thanks, Margarita. I think I'm a little bit stuck on your previous question to Lauren, because I was thinking about it in the context of what is written about Latinx folks, but also just the way that we talk about the community sometimes, or not we, but reporters and others, journalists talk about the community sometimes as a monolith. And I think that what you're sharing, I think, in terms of the Black community is important, because I think it points to the way that, like, frankly, racism and discriminatory practices across the board in this country affect people of color differently. And yet within that, right, like, we're not a monolith, we have different experiences. So I don't know, as connected to what you just asked, I think that's one thing. I think
And
we would love to see
feel
more.
free to expand on that, because that's a really great point, that it's not a monolith. And so please, expand on further if you'd like, and then jump to my next question.
Yeah. Well, I think that's my answer to the question, that, I think we would love to see more stories about the different types of Latinos in the community and the effects that, the policies in this, that are coming up, particularly around reproductive health and rights, have on the different communities. There's a huge proportion of the community that is Black, right? Like, there are Black Latinos who are disproportionately affected in many ways by what's happening, because of, again, systemic injustice and racism in our systems. There are a growing number of Indigenous communities from Latin America in the US who don't speak Spanish, who don't speak Spanish or English, I should say, who are having, sort of mounting language barriers in this country, and access to care, of course, with all the new migrants that are coming, as well. The systems that we have in place are not adequate for them to get the services they need, even basic services. And we're finding that many of those folks are again, impacted by the same kinds of injustices that others are, in terms of abortion bans and other kinds of barriers to reproductive health care. So I think that kind of story is really critical to be elevated in this moment.
So what are some of the questions you think reporters should ask, or what are some of the things that they should keep in mind? There's a link I posted there to a study in JAMA where the authors interestingly pointed out, when they were talking about the Hispanic women, that to remember that they're not all immigrant, that there are, millions of Hispanic women in this country who were born here. And so is that the kind of context that you would like to see more of, but what would those questions look like to, to reflect that the community is not a monolith?
I think elevating differences like that is really important. There are about 18% of the Latinx community in the U.S. is uninsured, and often, whether you're born in this country or not is a determinant of whether or not you have health insurance, right? And so, so I think that I see that as what I was going to say next about elevating the differences between immigrants and folks, Latinx folks who are born here. I think the effects are different. Having access to healthcare is such an important, an important step for people to have better health outcomes. And so I think there's definitely differences there. We'd love to see more about stories being told about the effects of reproductive health care bans on immigrants. Specifically, to elevate some specific questions, we think a lot about how when folks are talking about stories of folks, leaving states to be able to get abortion care, for example, it doesn't take into account often the fact that many immigrants in this country can't travel outside of their states, can't even travel outside of their communities for fear of detention and potentially being separated from their families because of their immigration status. And so there's some really heartbreaking situations that we know about that are happening in this moment for folks who cannot get access to the care they need because they cannot leave their communities. In Deep Texas specifically, we see that folks even trying to get other kinds of healthcare are afraid to drive the 50 miles that they have to drive, 50 to 100 miles they have to drive to get their medication for diabetes, for example, right? So because of, in Texas specifically, there are internal immigration checkpoints along some of the major highways. And so folks are afraid to drive through them because if they don't have documentation. And now with new laws that are attacking immigrant communities, we're seeing even more, the fear growing even more for people who are documented but are Latinx. And so those kinds of stories, I think, really teasing out some of the conditions that exist on the ground and thinking about how issues that are connected or related, like immigration and other kinds of social issues, come together to have effects on the communities that we're talking about, and in terms of reproductive health care access. I'll say one.
Go
please.
ahead. No, well, you do a lot of work you do work in different states. So what can you tell us about access to reproductive health? What are some of the things that you're hearing from women on the ground about not just abortion, but access to basic, let's call it OBGYN care or primary health care that your volunteers and your staff are privy to that we may not know about or not write enough about?
Yeah, I mean, we're finding that all healthcare has been impacted by abortion bans in many of the places where we work. And that's because in many of the places where there were formerly abortion clinics, particularly again in South Texas, in some parts of Florida where we work, the abortion clinic was the place where folks got birth control, where they got access to to basically hypertension care, to care for diabetes, right? It was in many cases these places are the first place that people get any access to care, especially when they're disconnected from the healthcare system because of not being able to have insurance, et cetera. And so so what we found that in many places around the country, folks who formerly had some access to healthcare no longer have it because of abortion bans. We're also finding that, again, I keep going to Texas because that's one of the worst cases in this moment. The number of providers of OBGYN care has decreased as well. So for people who many are forced to keep their pregnancies, but for folks who are choosing to keep their pregnancies, prenatal care access is now much lower than it was before. We're also seeing that because of the same issue, right, with birth control, the place where folks formerly were able to get this care, they're no longer able to get it. Thankfully, we and others have been working on getting over-the-counter birth control. So there's a new product now called O-Pill, which I hope folks will talk about and cover, because we really want the community to know that it's out there and it exists. And so we're just waiting for it to be put on the shelves, but basically that's a win, right? Like, we're able to get some level of birth control access for people that doesn't involve, or hopefully will not involve, them having to go, to drive really long distances, which again is very prohibitive for many people. That will be accessible to them in their price range, and that they can get without a prescription and off of a store shelf. But in general, we found that because of the bans on abortion, there have been some really great side effects to that have caused access to care issues. And then I'll add, one last thing that I mentioned previously, that with new immigration laws or anti-immigration laws, with a really, scary situation in southern states, and particularly in Texas, fear is frankly keeping people from getting the care they need. And I think that that's a story that hasn't been covered a lot. I think particularly with the new law in Texas, SB4, there's an even greater cloud of fear in the community around going out of their homes, around traveling, and again, doing what they need to do in order to feed their families and to get the healthcare they need.
What can you tell us about the work that you've done, related to the perceptions that, people, including journalists, may have about the views that Hispanic or Latina women have about abortion, about birth control, about even pregnancy? I was very surprised a few years ago when I learned that a significant proportion of abortions in Texas, for example, and I live in Dallas, and a lot of these, there's a lot going on in the country related to abortion that started here, or abortion access, that more than 35% of women in Texas who had an abortion for several years were Hispanic and Latina women, which surprised me, because I just assumed, that would not be true because of religious views or cultural views. So tell us more about that, about, some of the incorrect perceptions that we may have about Hispanic women.
Yeah, and that rate, Margarita, nationwide is 25% of Latina women have abortions. So, folks think that that's not, that's really bizarre and high, as you said, because of, what folks think that the community feels about abortion. But the reality is, the majority of U.S. Latinas in the support access to both birth control and abortion care. And that has only increased since the overturning of Roe versus Wade. One recent poll found that 73% of Catholic Latinas are against abortion bans. And we know about the rate is even higher for birth control use among Catholic Latinas, which again is contrary to what the religion teaches. But folks are just living their lives, right, and trying their best to be able to take care of their families. And so that shows that folks are like everybody else in this country. One other thing is that we know that in terms of birth control, one national poll stated that 71% of Latinas said access to birth control has been important in their own lives, and 78% said they support birth control to be available over the counter. So, the numbers are super high. It again matches with the rest of the country, and that's because, again, Latina folks know that they need this care in order to be able to, to rule their lives, right, to thrive, to be able to do what they need to do. And so, and they're no different than, again, anybody else in this country.
Lauren, this question is for you. I'm curious, what are, emerging trends that you're seeing in reproductive health trends, in Black and Hispanic women in the South? Is there more awareness, more written about, what's going on with Hispanic women and Black women? What can you tell us about that?
I am very interested in, again, tracking the data. I think, okay, so the last full year of data that I've seen, at least in South Carolina, I think was 2021. So we're barely just able to see how the pandemic is going to be impacting these numbers. And of course, it will continue to. I'm interested to see how lockdowns and the ongoing pandemic will impact infant mortality, maternal mortality, access to prenatal care, and then obviously the Supreme Court decision in 2022. But across the South, we haven't seen numbers that really reflect these huge things. So that's what I'm interested in. The last numbers I saw, as I have said, for the full year were 2021. And in the story I wrote in December, we were talking, I think, before the call started about Orangeburg, South Carolina. The infant mortality rate in Orangeburg, South Carolina in 2021 was literally worse than it was 50 years ago. So it's just like, I'm interested to see, and there's a hospital in Orangeburg. You can't say that for every rural part of the state. So I'm wondering where we're going to go from here, because the pandemic is going to have an impact. The Supreme Court ruling is going to have an impact, particularly in states like South Carolina. So yeah, those are the trends that I'm interested in. I guess, time will tell what we'll end up seeing, but I would not be surprised if things get worse.
So we've got 3 questions in the Q&A, so I'm going to stop asking questions and turn to the audience. So the first question is from Sally James, and this is a question. I wrote about the lack of post-delivery Medicaid coverage in Washington State and learned a lot about the relationship between postpartum mental health and access. Is there a nationwide place for data on postpartum mental health with a racial and ethnic breakdown, or by zip code? I don't know if you have an answer to that, but if we don't, Sally, you can reach out to me, and I'm going to put my email in the chat, and I'm happy to share that with you. So I'll move on to the next question. This comes from my colleague at the AHCJ, Karen Bloom. She covers health and IT, and she's been writing a lot about AI. And her question is for Lauren. In the story that you did in December of 2023, with the headline "Being Black and Pregnant in the Deep South Can Be a Dangerous Combination," how did you find the patients to interview and profile?
A combination. The main patient, who is the mom who is photographed, I reached out to a midwife who I know, because I thought that perhaps there are Black women who are so, this woman had children before. She was mistrustful of the hospital system, although, anyway, you can read the story, but I found her through a midwife. And then another woman, I think I found her through, I can't remember, but I developed relationships with providers over the years, and often they are, you know, they know that they can trust me with their patients. Obviously, no one just is handing out phone numbers, but I think what happened was she had reached out to a few people that she'd worked with, and then those people reached out to me if they felt comfortable talking. So that's how it works.
How do you make, sure, and I can't phrase it any other way, that the women that you're interviewing are representative of what data is reflecting? How do you go through that process?
I think that anytime you are telling a data story, and using an illustration, I just try to be extremely careful. And I need to make sure that I'm not, that this is a person, and she or he is not going to be completely reflective of the trends that we're seeing, that she has unique thoughts and unique experiences, and I should not try to like hammer her into the little box I'm trying to fit her into. So in many ways, the patients that I talk to for stories are representative of these larger trends, but I always try to remind myself that like they are putting enormous trust in me, and that they are more than their story. They are more than their healthcare story. And I really try not to take that for granted. So I guess to answer your question, like I do try to find people who, in some ways, illustrate these numbers that I'm talking about, while at the same time realizing that like there's so much more than a number. If that makes sense.
It does, and it's an important reminder, I think. Before I ask our last question here and wrap it up, Lupe, you're nodding, and I'm wondering what is going through what you're thinking about as she's saying that.
Yeah, I think I'm really grateful to hear Lauren talk about her approach with the individuals that she, whose story she elevates in her writing, because we work with people through our organizing work who have experiences that that tell the story of again, the injustices of who can share their lived experience around many of these things that we're discussing today. But they're often, or they can be sometimes afraid to talk to journalists because of the way that they fear they might be portrayed, or their fears around protecting their families or themselves, particularly with immigrants and folks who have mixed status families. There's just a lot of fear, and so I think an approach that works with someone to be able to support them in telling their story, and to be able to be a part of this reporting that thinks about them as a person and thinks about their family, I think is really, really important to getting these sources and to getting these folks to talk and share their stories. So I'm grateful to hear that that's an approach, and I'd like to ask that be a part of what others are thinking, other journalists are thinking when approaching organizations like ours to connect about potential sources, and when they're working with the individuals themselves. I think also, we also specifically are working with someone right now who works 3 jobs and, doesn't have a ton of time to talk, is really, really interested in sharing her story, but we have to be flexible and find little snippets of time in her schedule to be able to connect. And so I think that as well, just recognizing that the folks that many times that are the most impacted by these issues have life experiences and just conditions in their lives that are really tough. And so being able to connect with them through those barriers, I think, is really important.
Well, I have just looked at the clock and realized that we have run out of time, but I want wanted to thank you both again, Lauren and Lupe, for making the time for this webinar today. And thank you all who tuned in. If you joined us late, you will find the recording of the webinar at healthjournalism.org in just a few hours. And once again, I want to thank our presenters for taking the time to share their perspectives and experiences and expertise. And the AHCJ will continue to bring webinars, bring you webinars on a variety of health topics as a perk of your membership. So for the journalists who are listening, if you haven't joined, please do so today. And I also hope you are going to our conference in New York. And I'm going to type my email here in the chat. So if you have any further questions or want resources, I'm happy to share those. The AHCJ website has a lot of them. And have a good rest of your week, everybody. Thanks again. Thank you, Lauren, and thank you, Lupe.